In this morning's Women's Doctor, no one wants to hear that they have a tumor, and while a benign tumor sounds like it's less scary because it's not cancerous, it can still be dangerous. Joining us this morning with more information is Mercy Medical Center Dr. Kelly Orwat. Good morning.
Good morning.
Tumors, goodness gracious, whether they're cancerous or not, can still be dangerous.
Exactly.
Why is that?
Well, even if they're not cancerous, they can still cause problems, particularly things like meningiomas, where they are growing in the lining around the brain. They can invade locally, so cause pressure. They can be painful. They can press on nerves, cause a lot of symptoms and a lot of trouble just from pressure locally.
I can see how that could affect your vision. You could have really bad migraines.
Oh, yes.
Things like that. And really, tumors can literally happen anywhere in your body.
Right.
For a lot of women, myself included, we've talked about this before, fibroids are a big deal. Why are we more susceptible to getting these benign tumors than men are?
Yeah, a lot of it's hormonal related. So the different hormone milieu of women does tend to make us more predisposed to a lot of these tumors.
Is there anything we can do?
So to prevent them, not so much, but there are a lot of different treatments for them.
Okay.
And so radiation is a very good treatment for a lot of these benign tumors. Surgery as well, but some places you don't necessarily want to have surgery, particularly if it's in a shaky area of the brain where you couldn't get it out without compromising nerves.
Okay.
So that's where radiation comes in. And if it's a small tumor in a tricky location, sometimes we can do it in just a single treatment.
You were just telling me about little tiny tumors that you can have in your hands that can actually cause your fingers to curl. What were they called?
Yeah, Dupuytren's contractures. So they start with these little fibrous nodules along the tendons in the hands, in that fascia, and they grow, they can be tender, and then they cause the tendon to contract down, so it pulls your fingers in. And so once you have the full contracture, the surgeons can release that at some point, but radiation is actually useful when you're forming the nodules to prevent the contracture itself.
How is it that the radiation kind of battles the tumor? Because we think about radiation, we think about cancer, but these are not cancerous.
These are not cancerous. So in the setting of a meningioma, you're ablating the abnormal cells. In the setting of something like Dupuytren's, it's a very low dose, and so you're addressing the inflammation. So it's more of an anti-inflammatory effect, much like when we treat osteoarthritis, which is something that's becoming more and more common with radiation. It's that anti-inflammatory effect we're going for.
You're using doctor words. Ablating, you're thinking about that's cutting off the blood supply.
Oh, yes, that does sound more like cutting off the blood supply. But no, it's really just using such a high dose of radiation that it essentially kills the abnormal cells.
Gotcha.
And that's why it's very targeted in.
All right. Well, if you got something funky going on, go and get it checked. That's what we say. Go and get it checked early because you also want to make sure that it is benign.
Correct.
Gotcha.
Correct.
All right, Doc. Thank you so much for joining us this
morning. Of course. Thank you for having me.
All right. Well, if you have any other questions or would like a referral, call 1-800-MD-MERCY.